Okay, so now let's talk about two major approaches, postmodern approaches to therapy. The first one is solution-focused brief therapy. The another one is narrative therapy. We'll talk one by one. So let's start with solution-focused brief therapy. This therapy was developed by Steve Sager in Superb during 1970s and 80s. Uh, Solution-focused therapy uh, places more importance on discussing solutions than problems. Of course, you must discuss the problem to find a solution, but beyond understanding what the problem is and deciding how to address it, solution-focused therapy will not dwell on every little detail of the problem that the client is experiencing. Uh, Solution-focused therapy is future-oriented, so it will not dive deep into your childhood or explore all the myriad ways in which your past has influenced your present. Instead, it will root your sessions firmly in the present while working toward a future in which your current problem or problems have less of an impact in your life. Uh, Solution-focused brief therapy has positive orientation, means it believes that people are competent to construct solutions that can enhance their lives. So it has a positive orientation of human nature. Uh, Another one is a key concept of solution-focused brief therapy is exceptions. What is exceptions? So one of the key assumptions of SFBT is the idea that solutions to one's problems are typically found in the exceptions to the problems, meaning the times when the problem is not actively affecting the individual. For example, if a client is struggling with, let's say, excruciating shyness, but typically has no trouble speaking to his or her coworkers, a solution-focused therapist would target work as an exception to the client's usual shyness. Once the client and therapist have discovered an exception, they will work as a team to find out how the exception is different from the client's usual experiences with the problem. The therapist will help the client formulate a solution based on what sets the exception scenario apart and aid the client in setting goals and implementing the solution. Therapeutic goals. One of the major goals of therapy is to help client form meaningful goals. A counselor can help client to form meaningful goals by inviting client to talk about why he is seeking therapy, what are his wishes, what he wants to achieve through the therapy, uh, what are the complaints he's having, I mean the problems, and what he really wants to achieve through therapy. Another way of doing that is by using miracle questions. A miracle question is a method of questioning that counselor can utilize to invite the client to envision and describe in detail how the future will be different when the problem is no longer present. Another way to help client form meaningful goals is by asking exception questions. Uh, there are always times when the identified problem is less severe or absent for clients. So the counselor seeks to encourage the client to identify these occurrences and maximize their frequency. Another important thing about while helping client to form therapeutic goals is to make sure that the goal is manageable, means that is small, realistic, and achievable. Once the client is able to make changes by achieving these small goals, it leads to additional positive outcomes. Coming to the doing part in this therapy, uh, there are various techniques that counselor adopts to help the client move towards in a desired direction. Uh, the first technique is pre-session changes. So what happens in the very first session, the counselor asks the client what are the changes that the client has experienced after he scheduled this appointment, and between the schedule of this appointment and the very first session. And this is done intentionally by the counselor to help the client understand that even before therapy starts, client has some resources, some type of positive changes are happening in his life. So it puts the client on a very positive note, and kind of set a tone of optimism for the client. The other technique that is used is the coping questions. So coping questions are the questions that help client focus on what they have done so far to survive difficult situations. uh, these types of questions elicit the attention away from the client's fear of problems to helping them find inner strengths and adaptive powers. This technique helps clients take their minds off of the failure and put the attention on what has worked for them so far. An example of coping question can be like the counselor asks the client, "What have you found helpful so far?" The other techniques include exception questions. Uh, so what happens in this technique is there are always times when the identified problem is less severe or absent for the client. The counselor seeks to encourage the client to identify these occurrences and maximize their frequency in the client's life. Miracle question is another method of questioning that counselor can utilize to invite the client to envision and describe in detail how the future will be different when the problem is no longer present. Scaling questions helps to measure the effects of a problem on a person's life. For example, clients are asked to select a number of where they are on a scale of 1 to 10, where 1 is the problem controls the client and 10 is the client controls the problem. Clients are then asked where they would like to be by the next session. Uh, Once that question is answered, the counselor asks clients what would have to take place, for example, to get from 3 to 5 on the scale by the next session. Uh, Another way of helping client is formula first session task. It is a form of homework that counselor gave to the client after the first session. The counselor asks the client to observe what happens in family life, marriage, or relationships that he wants to continue to happen in future. The client shares his observations when he comes for the second session. Uh, this assignment instill hope in client that change is inevitable, and it tends to increase optimism in the client. The last one is therapist feedback to the client. So in this technique, counselor takes 5-10 minutes break towards the end of the session to compose a summary message for the client. This summary message include what a strengths counselor has observed in the session, some signs of hope, what the client is already doing that is useful in moving towards the desired direction, and the counselor shares his observations with the client. Coming to the being part of solution focused therapy, relationship is very important component of this therapy. Uh, some people have perception that solution focused therapy is more focused on, it's a technique driven approach and more focused on techniques, but this is not the fact. Both the pioneers have emphasized the importance of developing a strong therapeutic alliance by making sure to ensure a climate which include the core therapeutic conditions to uh, to bring the change in client. So the relationship looks more kind of collaborative between the client and the counselor, uh, and the counselor focus more on the strength and resources that is available for the client. Uh, yes, they do focus on the problem of the client, but only to understand the nature of the problem, and their major focus is on finding resources and strength of the client that can be utilized to move towards the solutions. of the problem that the client is experiencing. In solution-focused therapy, Caesar has identified three kinds of relationship that can happen between a client and counselor. The first type of relationship is a customer kind of relationship where both the counselor and the client are actively involved to find out the solutions. So the client really understands his own responsibility of active involvement to come up for the client to move towards finding solutions. The second type of relationship which may happen in therapy is a complainant type of relationship where the client is not taking up the responsibility and feels that other people are responsible for his conditions. So the client is more focused on changing others rather than taking responsibility and actively involved to find out solutions. The third type of relationship which can happen in therapy is a visitor kind of relationship where the client feels more dependent on the counselor to find solutions. And generally it happens when somebody is kind of mandated by court or mandated by, not mandated, but kind of forced by the family members to seek therapy. So again, in this relationship also, the client is not kind of actively involved to seek solutions. So among all these three kind of relationship, customer type of relationship is very much emphasized to help client come up with solutions to move in a positive direction. Another important thing about solution-focused therapy is counselor is always focused on, not always, but his major focus is on the solution talk rather than having a problem talk. One of the key premises in solution-focused therapy is whatever you focus on increases. So as a counselor, if I focus more on the problem will increase. If I focus more on the solution will increase. So so the counselor focus more on the solutions rather than having a problem talk. Yes, they talk about the problem, but only to understand the problem rather than spending a huge amount of time try to find out the past and all that stuff.